you yourself do not suffer from low back pain, I'm sure that you know someone who does. As a person who suffers from low back pain herself, I found it interesting to research this topic. Low back pain is the second most common neurological ailment suffered by Americans today, following only headaches. On average, Americans spend about $50 million a year on the treatment of chronic and acute low back pain. As a PT and OT technician at a rehabilitation facility, I've spent 11 months seeing, helping treat, and even suffering from low back pain myself, and I know that there are options. Two of these options in which I'll talk about today for the treatment of low back pain include physical therapy and the use of NSAIDs. Chad Bromé and Stephen Cohen's book, Managing Pain, Essentials of Diagnosis and Treatment, shows that NSAIDs are the most common medication prescribed to patients suffering from neuropathic pain. NSAIDs are non-steroidal anti-inflammatory drugs. They're found over the counter, and they are used to decrease stiffness, decrease pain, and improve movement. In cases of low back pain, where arthritis is the cause, slow tissue damage causes the pain. NSAIDs help this by blocking the pain receptors from reaching the brain. Other cases of low back pain are inflammation. NSAIDs help this by reducing inflammation, hence anti-inflammatory. Less inflammation results in less pain. Certain NSAIDs are better than others. However, the two together show no benefit. Benjamin Friedman's double-blind randomized study shows that ibuprofen administered to patients had an 11.9-point growth on the Rowland-Morris Disability Questionnaire. Ibuprofen and acetaminophen together showed an 11.1-point growth on the Rowland-Morris Disability Questionnaire. This shows that there's no advantage in taking both. Friedman's research proves that acute, non-traumatic, non-radicular low back pain is helped by taking ibuprofen or acetaminophen alone. It is safe to take both of these pills together, but there is no benefit in doing so. Along with NSAIDs, patients can use physical therapy to aid in low back pain and give them greater mobility. Edward Shipton's academic journal, Physical Therapy Approaches in the Treatment of Low Back Pain, showed 82% of physical therapists in a Washington state study reported that patients who were educated, who exercised, who used electrical stimulation and thermal modalities resulted in less pain in all chronic low back pain and acute low back pain cases. Physical therapy can be broken down into two categories: stretching and strengthening. Half the cases of low back pain are the result of tight muscles in and around the spine and hips. Stretching helps to release the tension in the muscles, therefore improving movement and lessening pain. The other half of the cases of low back pain are a result of weakness. Strengthening of the muscles in and around the hip and spine can help with this pain. Specialized exercises target these weak muscles, therefore increasing stability and decreasing pain. Stopping compensation and overworking of these muscles helps reduce inflammation and increase better movement. Physical therapy is a prominent and valid option. Physical therapists' scope of practice in the state of Mississippi allows them to contact your medical doctor and request scans like MRIs and CAT scans if they think that your diagnosis is above the use of physical therapy. Physical therapy can also be used in a prehab measure. Many insurances will not cover extensive options until physical therapy has been utilized. Bianca Fredner's periodical, Physical Therapy as the First Point of Care to Treat Low Back Pain, showed that patients who reported to their DPTs, physical therapists, had less injections, less surgeries, less emergency room visits, and lower health care plans. Physical therapy can save patients so much money by utilizing just simple exercises. Physical therapy is used to reduce pain associated with chronic and acute low back pain. In conclusion, utilizing the use of NSAIDs and going to your PT appointments has unmatched improvement by low back pain patients worldwide. Having the ability to research this topic has showed me that there are options. Living in pain is not normal. You should not be living in pain. With the vast amount of resources available today, like NSAIDs, like stretching and strengthening and physical therapy, your life should no longer be in pain.